back. November is American Diabetes Month. According to the CDC, more than 37 million people in the United States have diabetes, and 1 in 5 don't even know they have it.
Yeah, so we want to talk about what we can do to prevent diabetes, or at least catch it in the early stages. Dr. Lakshmi Emory from Aetna Better Health of Illinois joining us this morning. Dr. Emory, thanks for being with us.
Thank you. Good morning. Thanks for having me.
So this is such a serious concern, especially for minority populations and communities. Can you talk about those disparities and the impacts that you've seen with that?
Yes. So as most chronic conditions, we see that there are more impacts in minority communities, unfortunately. And that often has to do with resources. So there are communities that are under resources that don't have fresh food markets in their area, and so they're disproportionately impacted because they don't have the resources to have the appropriate diet to prevent some of these diseases, and that includes diabetes. And so diabetes is often called one of the silent diseases, where you don't have any symptoms until it's almost too late, or until things are pretty far gone. Some of the symptoms you may have are increased thirst, increased hunger, and also increased urination. So if you have any of those symptoms, you want to see a clinician right away to see if you have diabetes and if you can be treated for that.
So, doctor, we want to talk about prevention. What are some key things people can do now to keep diabetes at bay?
Well, this is one of the diseases where diet and exercise are extremely important. So, just walking several times a week can be something that prevents it. Also, making sure that you're not overloading on sweets and on carbohydrates, bread, French fries, fast food, all of those things can contribute to development of diabetes. Also, family history. So there are some families in which many people have diabetes. So if you know that your mother, father, sisters, brothers, have or had diabetes, you want to make sure that you're tested at your annual physical with a test called the hemoglobin A1C, or a blood glucose test. And so your physician can determine from those tests whether you're at risk or whether you're pre-diabetic. Many people are pre-diabetic and don't realize it.
Yeah, the family history part, so important. I know I've really looked into, okay, what could I be more likely to maybe deal with, or how can I help it? So let's talk about people already living with diabetes. Other than medicine, what can help control their blood sugar? What are your recommendations?
Well, again, especially with diabetes, if someone is already diagnosed, lifestyle is extremely important. So the exercise will help even after you've been diagnosed. In addition, making sure that you have a diet that's high in fruits and vegetables, lean proteins, low in fat, low in carbohydrates, all of that is extremely important. Also, once you've been diagnosed, you want to make sure that you're checking your blood sugar regularly yourself, so that you're monitoring, what makes your sugar spike, for instance, and what keeps it lower, and also sharing that information with your physician. That's extremely important, so that they can monitor your medications, how those are working. They can adjust the doses if necessary, or switch you to a newer medication if needed.
So speaking of that, for those who are curious out there, what should your blood sugar be at? And then when should you worry about the number?
Right. Well, you want it to be under 200. So that's one of the diagnostic markers, that if you find someone with what we call a unfasting glucose of over 200, that's a sign that they may have diabetes, and then they will do further testing, to determine that. So you generally want your sugars to be lower than 100 to be in the normal range. But all of this it needs to be looked at with your physician, and it needs to be looked at with regard to when you've last eaten. So we want to do a fasting, usually, to make sure that the diagnosis is correct. But all of this, again, should be discussed with your physician at your annual physical when they're doing screenings.
I'm so glad we're talking about this for Diabetes Awareness Month. I think it's that time when you have to say, okay, I know I like the sweets, I know I like all this stuff, but I've got to make a decision, not just for how I look, but my health, right?
That's very important.
Right. Yeah, it's everything in moderation. I mean, everyone, wants to enjoy. We're coming up on Thanksgiving, so there'll be lots of pie and cake and things like that. So it's just moderation, even for those without diabetes. We don't want to overindulge on those sugary, sweet foods, and also those high carbohydrate foods.
Yeah, definitely. Dr. Lakshmi Emory, thank you so much for all your help. We really appreciate you shining some light on this and the disparities in this as well.
Thank you so much for having me.
Some good information. I feel like we learn so much every time.